So, we've talked quite a bit about discomfort, pain. Now I'm going to talk about some things that can help. And the first category I'm going to be talking about is movement. And movement can be quite difficult when you're uncomfortable, but it is so important. It's very helpful for pain and stress reduction as well as overall health. But if you haven't been participating in very much movement or exercise, it's quite important to discuss this with your doctor or another medical professional before starting a new exercise program. You may need to adapt any movement to your current abilities, but swimming or water activities, and there's many types of classes that are geared towards helping people that may have limited abilities be in the water, which is very soothing to the body. And many people find when they're in water moving around a bit that they're much more comfortable. Yoga, Tai Chi, and Qigong have been researched and are all quite helpful for pain and stress reduction. It is important for you to find a class that is appropriate for you and to talk to the instructor about that person's experience working with someone that has pain or working with someone that might have MS. But that's something that can be quite helpful if you would like to check that out. Any kind of stretching that allows your body to have more flexibility, not tense up as much, is very helpful. And then the assisted therapy of riding a horse has been found to be very helpful in increasing people's ability, lowering people's stress, and decreasing pain. This may or may not be available around you, but there are a number of programs you can check into. And lastly, any type of exercise that increases strength, flexibility, and relaxation, but doesn't increase your symptoms, that isn't uncomfortable for you to be doing, is very helpful. And you need to make that assessment of not overdoing it, but finding just the right amount of movement so that you can feel more comfortable, feel better, feel stronger, more energized. There are a number of physical and medical interventions. Physical interventions include the application of heat or cold, and people don't often think about this, but it can be really helpful. Massages can feel really good, and ointments or lotions or salves that you can apply that might create a sense of warmth, if that's what feels most comfortable, or cooling, can feel really good to people. Medical interventions include physical therapy, physiotherapy, which would take place in the water. Acupuncture has been quite helpful for pain. And there are a number of different medications. That chart is included in your handout. And then there's mind-body interventions, and we'll talk more about what mind-body interventions are in next week. But these interventions include things like imagery. There's that word again, psychoneuroimmunology, psychotherapy, meditation, hypnosis and self-hypnosis, deep breathing and relaxation techniques, biofeedback, and energy therapies. And just basically mind-body interventions help you to use your mind to help your body, and body movements to help settle your mind. Some of the assignments will be mind-body interventions, and as I said, we'll be talking more about that next week and in the week after. What will you be learning next week? We'll be talking about what happens when you experience stress, when the body experiences stress. Talking some about depression and how thoughts and beliefs can influence your experience with pain. From cognitive behavioral therapies, the negative schema and positive self-talk. We're reviewing some coping strategies and the effects of fear and bracing in the body. And we'll be looking at how to change your experience with discomfort. And this is the end of the educational portion of this week. And the next part is the assignments. I'm going to ask you to listen to those assignments, and you will be guided with some relaxation as well as a couple of other things that you can be doing on your own.